Okay. So I'm just going to review this slide right here because it gives us a perspective of what's believed to be one of the principal functions of a metal. So here we were focusing on gold compounds. So this was gold compounds with phosphine ligands, and these are bidentate ligands. So we were having these bidentate ligands providing this tetrahedral coordination around the metal. So the objective was to try to improve the stability of these compounds, or at least decrease the relative lability, so that these can enter within the cellular environment and be able to attack the thioreducin system. So essentially, they still require the metal to have a coordination site available and to be able to interact with either the seleno groups or the thio groups that are part of these enzymes. Okay? So this would be in the cytoplasm, but also within the mitochondria. You have this thioreducin reductase system that exists. And so with these type of ligation system, you could improve the relative stability, but still facilitate the dissociation of the phosphine so that that gold can be able to coordinate to the selenium or the thio group. And so the proposed mechanism of action leads to what is believed to be an apoptotic cell death triggered by disrupting this system. And so what we were discussing at the end was switching from a phosphine-based system to a carbene-based system. So using these N-heterocyclic carbenes, just because of the type of interactions that are capable with these type of ligands, which are carbon-based, so forming these organometallic compounds, and exploring the functionality of these substituents, the more bulky, to prevent or to improve the stability of these compounds. Because essentially here, we're going back to sort of the original design of these linear compounds. We have coordination number 2, but by using those R groups that are bulky to try to prevent the dissociation of the metal or the accessibility of that metal. So what I was showing you at the end was an example of a family of these ligands, and essentially showing the effect that they have on a breast cancer cell line. So these are 3 different compounds. So the difference being the R groups that are on the actual NHC ligands. And so we see the relative potency. Okay, so you can determine the IC50 from that set of data. They seem to be fairly comparable. Perhaps that 1B, which is with this N-propyl group, that's probably a little bit more potent if you look at the higher concentrations. But generally speaking, they're about equivalent. And then you look at their proposed mechanism of action that might be targeting the thioreducin system and the glutathione reductase. And it seems to be that the activity is targeted towards thioreducin reductase, which is known to have a seleno group at the active site, and the glutathione reductase does not. So that's kind of the point of this slide right here, just to emphasize the subtle difference between a thio group and a seleno group, in that the gold seems to be able to be a much more capable of targeting that thioreducin reductase system. All right, so what we didn't touch upon, I'm just going to briefly talk about, is looking at GOLD3. So in the previous lecture, we talked about how GOLD3 is something that is accessible, but typically you would have GOLD1 that would predominate in a biological system. And so here, when we're looking at GOLD3, it is isoelectronic and isostructural, and you're talking about coordination chemistry with platinum-2, because here you're talking about a system that is D8. And so anything typically D8 transition metal would be something that would have a square planar coordination. Now, the big difference between these 2 metal ions is the relative stability. So GOLD3 is actually quite unstable, and it's very prone to reduction, whereas platinum-2 is basically redox inert. And so because of this, GOLD3 can be readily reduced to GOLD1. All right. And so if we're trying to design coordination compounds to really exploit the GOLD3 oxidation state, then the key thing is to facilitate a ligation that can stabilize the oxidation state of that metal. So GOLD3 being more intermediate in terms of its hard softness, obviously it would have its difference in terms of coordination preference than GOLD1 would have. And so you can imagine that it would be able to form similar types of coordination compounds that GOLD2 could form. So as an example, being able to coordinate to the nitrogen groups of the DNA bases. And so that's been a proposed mechanism of action of what gold can potentially do by being able to form adducts with DNA. So here's just a representation of gold being able to coordinate to guanine. A little hard to see here, but it's coordinating to the same site that has been proposed for platinum to be able to coordinate within DNA. And so the key thing is to try to stabilize that oxidation state. And so here, just in a representation of coordination complex that have been designed for the purposes of being able to exploit this oxidation state. So what you have here are chelators, which have good sigma donation capability, ligands that in the cis position that are easy to displace, enabling the metal to act analogous to cisplatin. So what do I mean by that? So here's an example of a ligation system that, when coordinating to gold, facilitates a sigma donation. And so you have that bidentate coordination via the nitrogen, but also via the carbon from that group here. But then you have this arrangement of two ligands that would be relatively labile, and so, or at least facilitate the this metal to be able to coordinate to DNA if that is a target of the actual metal itself. Another route that people have tried to stabilize that oxidation state is by taking advantage of what we discussed earlier in the course, which was the macrocyclic effect. So this is a type of chelator that allows for a coordination around the metal center, in this case, via these four nitrogen groups, that basically provides for this planar arrangement around the metal, but also provides that electronics around the metal system that helps protect that oxidation state. And so compounds like this have been designed. And so the one that I have represented here, this one has relatively high anti-cancer activity. So reported IC50 values that are in the sub-micromolar concentration range. So when we're talking about sub-micromolar, we're talking about high nanomolar IC50 values. And so this has been observed against cisplatin resistant and cells that are also known to be multi-drug resistant. All right, so like other gold-3 complexes, the metal ion may be able to target DNA, but the main mode of action still appears to be mitochondrial targeting of the thioredoxin system. So it seems to be that even if the metal has that capability of acting like platinum, it still seems as though the primary mechanism of action of the gold, even as gold-3 or maybe reduced ultimately to gold-1, to target the thioredoxin system, just like we saw as far as the previous proposed mechanism of action. All right. Any questions before I move on? Go ahead, Margaret. So I think basically you might be able to facilitate a little bit of redox chemistry there, but I don't believe that that's a principal mechanism of gold itself, because this idea of cycling with gold from 3 to 1, it doesn't seem as capable as something you would see for iron, like iron 3 to 2, or even for copper 2 to 1. So I don't think redox cycling is something that is, at least with these coordination systems, as likely to be the case. So I don't think there's going to be a major contribution to the overall mechanism of action. Other questions? All right. So what we're going to do is continue our discussion about coordination compounds and their contributions to the anti-cancer field. Let me just switch over to here. All right. So we're going to look at compounds that have a responsive feature. So what does that mean? So they respond to some sort of trigger. It could be biological or something external that's going to trigger an activity. So let's look at this from a very simple perspective. We have a coordination compound here. So here I have a representation of a generic compound with a metal labeled M. We have this octahedral system. And I highlight one of the ligands as X, color blue, because there's something about the identity of that ligand that's going to potentially facilitate an activity. So an example being that you have a biological or an external stimuli that's going to lead to an activating agent because of that interaction between that metal and that particular ligand. Another possibility is that you have the use of the metal as a drug carrier, and it's going to result in the release of X as a drug itself. where then the metal may not necessarily participate in the actual mechanism of action or the cytotoxic mechanism of action. Another possibility is that the compound as it is a prodrug. And what that means is that it in itself is not active, but because of a certain stimuli, it transforms into a drug. And in this case, it could be as a result of a dissociation of that ligand X, activating the drug, the metal complex that forms, whatever speciation that results, and facilitates a particular physiological effect. So this is what we're going to essentially look at. To some extent, we've already been looking at some of this. All right, so what I want to emphasize here is some of these stimuli that can be due to the environment in which you have tumors. So we've looked at this from some perspective previously. So when you're thinking about the environment of tumor, it is quite complex. So the extracellular environment surrounding the tumor cell is actually fairly acidic when you compare it to the pH of blood, or you even compare it to the pH within the cytoplasm. So it's acidic, but I don't mean to say that that's like super acidic. It's something like about a pH of 6.5, whereas when we're talking about the pH of blood or even the cytosol, we're talking about something that's a pH of 7.4. But that's enough of a difference that people try to exploit that in terms of their design of something that may be released and be able to more readily enter into the cellular environment. But there are also additional features that we have to take in consideration. We've talked about this a bit, where here we have this perspective of a tumor as it is associated with the blood vessel. And so you have then the corresponding supply of oxygen and how that can then give you a sort of a gradient of oxygen, where those cells that are closer to the blood vessel would have probably a normal amount of oxygen, but then as you move further away, then you have a lower amount of oxygen. So then you have cells that are hypoxic. And so the key point of emphasizing that is that now you're going to have cells that are, as they're further away from these blood vessels, are able to survive under conditions that are not necessarily the normal conditions for tissue growing. And so that can be enough of a difference for certain compounds not to be as effective as they were designed to be functional for cells that are probably more close to the actual blood vessel. So that's something important to think about in terms of what type of compound one is trying to design and what mechanism of action. So emphasizing this, cancer cells do consume a large amount of oxygen. And so you have a partial pressure of oxygen within a blood vessel that's about 5 millimeter of mercury, and that can drop all the way down to 0 at a distance of 150 to 200 micrometers from the blood capillary. Cells near blood vessels grow under normal aerobic conditions, but those further away have adapted to the hypoxic conditions. So at very low partial pressures of oxygen, cells become necrotic. And so those cells necrosis is a type of cell death, so they would die. But that's not necessarily a good thing. Why not? Because those cells will then leak the components of these cells, and that can lead to a type of metastasis, right? So these are important features to be aware of. All right, so I've talked about this previously about, in general, the intracellular environment is reducing. So that's why I bring up the point about the physiological values of certain metals and their oxidation states. Well, so hypoxic cells have higher levels of reducing agents like glutathione and ascorbic acid than aerobic cells. Here, I'm just providing you the concentrations of, or normal concentrations of these within blood, but also within the cytosol, just as a point of comparison. So you have glutathione, that's abbreviated GSH, concentration of 850 micromolar within blood, ascorbic acid, abbreviated ASA, concentration of around 100 micromolar within blood. But when you look at them within the cytosol, the concentration is significantly higher. You have about 2 to 10 millimolar of glutathione. I will note that glutathione will exist in both its oxidized and reduced form, because that's actually an important feature in order for it to facilitate redox control. And ascorbic acid is about 1 millimolar. Ascorbic acid is known to be something that plays a significant role as an antioxidant. All right, so one of the things that I want to focus on is this idea of activation by exploiting the redox, or at least the reduced environment of cells. And so here we're going to look at prodrug activation by redox. So a common mechanism for activating a metal-containing prodrug involves the reduction of an exchange inert complex to a lower oxidation state compound that results in ligand dissociation. All right, So the idea is that you are going to take advantage of something that is stabilized because of its ligand exchange inertness, but then using the environment of cancer cells to try to transform it or biotransform it in something that will potentially be useful therapeutically. So let's look at an example, platinum-4 compounds. So platinum-4, we're talking about low spin D6, and we had already mentioned how platinum-2, D8, is something that is ligand exchange inert. So is platinum-4, and very slow at ligand substitution. But here, what we're trying to take advantage of is how by changing the oxidation state of the metal, you change the coordination chemistry of it. So when you talk about platinum-4 with and comparing it to platinum-2, platinum-4, higher oxidation state. So you're fine-tuning that hardness of that metal. It's more intermediate, whereas platinum-2 is softer. And so because of that, platinum-4 is able to have, to coordinate to harder bases. And so you're able to generate these coordination number 6 complexes. So here's just a representation of this particular complex, which is oxoplatinum, designed for exploiting the oxidation state of 4. So you take that compound, which would be ligand exchange inert, you put it into an environment, the cellular environment, and by exploiting the reducing environment there, you're able to reduce that metal from 4 to 2. The consequence of that reduction is that you have the release of the axial ligands, so in this case, the hydroxide ligands. And so what you're doing is you're forming cisplatin within the cellular environment. So essentially, within the environment, you're creating that compound, which we know to be an active drug. So along the same lines, you have a lot of studies that have been done trying to prepare platinum-4 compounds for the purpose of stabilizing those compounds, but then taking advantage of the redox within the cellular environment. So here's an example of mitoplan, where here the design is of a dual nature. All right, what do I mean by a dual nature? So we're trying to take advantage of the features of this compound to trigger cytotoxicity on the constituents of here. So here we have the platinum-4 compound, which consists of where we see the typical amine, the chloro group, but also this other ligation system, oxygen-based in this case, that when this complex gets reduced, we have the formation of cisplatin, but we also have the release of this ligand. And that ligand actually has the capability of disrupting the mitochondrial membrane. So as I mentioned in our previous lecture, also 2 lectures ago, disrupting the mitochondrial membrane can trigger the release of cytochrome C, and that's something that's quite effective at triggering apoptosis. So now you're exploiting the use of the ligand and also the cisplatin to be able to have a more pronounced cytotoxic effect. All right, so let's explore the mechanism of reduction. So here's just more of a thought process of what could be contributing to this and how that can lead to at least the platinum, the effect that it might have. So I mentioned to you ascorbic acid and also glutathione as potentially participating in the redox within the cellular environment, and in this case, looking at what contributions they could play. So here we have the general representation of the platinum-4, this octahedral complex. I can't see what that says. Oh yeah, Brenda, you have your mic on. So we can hear every single cough. All right, so we have this octahedral complex, and then in the presence of ascorbic acid, what we see, the net result is reduction of the platinum from platinum-4 to 2, and then we see a conversion of the ascorbic acid. All right, so here, what we're looking at is an oxidation of the ascorbic acid. And the way we're seeing this is by focusing on the carbons. So I'm not sure if you remember back in biochemistry how to determine the oxidation state of carbon. Well, here in ascorbic acid, both of these carbons have an oxidation state of +1. But then in this process of a 2-electron release, a 2-electron reduction of the platinum, well, that's actually coming from this carbon, these 2 carbons from ascorbic acid, and they're now transformed into +2 oxidation states. So those 2 electrons that are released would be taken by the platinum center. All right. So as far as mechanism of how does this happen, this is an outer sphere mechanism of electron transfer. So in terms of the terminology, outer sphere means that it does not involve coordination to the actual metal itself. So what's happening here is there's a direct contact current between the ligand and the ascorbic acid that's facilitating this movement of electrons, and not because of a direct to the actual metal center itself. So the reducing agent, in this case, the ascorbic acid, which actually does have good metal binding capability, but in this case is not coordinating to the metal itself. So what we're looking at here is a process of reductive elimination. All right, so that terminology means that the metal gets reduced, and that reduction results in an elimination of ligands. All right, so what has been observed when looking at complexes of this nature in the presence of DNA is that you have, at the end, DNA unwinding in a manner that's analogous to its interaction with cisplatin. So it appears to be that you are in fact generating cisplatin in solution, and that cisplatin can then affect the DNA as you would expect. So this is probably something you can see by an agarose chart. All right, but this contrasts this by looking at the same reaction, but you're looking at here with glutathione. All right, so glutathione, a very important tripeptide. And so this particular reducing agent is different from in this case, is different from ascorbic acid. So what we need to consider is the number of electrons that can be shuttled with glutathione. So here, the key point is the actual thiol group itself. So the thiol group is important in terms of its metal binding capability, but in terms of the electron transfer, it can facilitate the transfer of one electron. And so here, the thiol group has an oxidation state of -1, but because of the actual reduction of the platinum from platinum 4 to 2, what we see is the oxidation of the glutathione. The oxidation in this case is of dimerization, where then both thiol groups become an oxidation state of 0. And so that's where we have the 2 electrons coming from, and those are the 2 electrons that are reducing the platinum. But then we have an extra element here where you are generating cisplatin, but that's not the end of the story. Now you have the capability of, in this case, excess glutathione that can coordinate to the metal center. And so we've talked about this previously, this ability of glutathione to coordinate to the metal center. And actually that can contribute to some of the resistance that cells can develop against platinum itself. But in this context, what you're doing is now you're transforming the metal in such a way that it may not be able to operate in a manner analogous to cisplatin. And in studies that have been done in vitro, it has been observed that you take the same chemistry in the presence of DNA, and you don't have identical reactivity as you would if you just worked with cisplatin itself in the absence of glutathione. And that's because it's believed that this biotransformation can lead to DNA interactions that are of a monoatom, as opposed to the interstrand or intrastrand adducts that can form with cisplatin itself. Okay, go ahead. Exactly. So that's actually an important feature, and something we should look closely at, because in this way, you can see the platinum actually play a role in terms of reducing the effective concentration of glutathione, because glutathione is sort of a cofactor to activate that GPX4, right? And so the platinum itself can be effective at reducing that. And that's why I included Brenda's paper from the last lecture as something that might be worthwhile further looking at. I don't know if there's been subsequent papers exploring that, where platinum nanoparticles, in that paper, they show that it can effectively lower the amount of bioavailable glutathione. So it would be something that could trigger ferroptosis. And in fact, it has been shown that cisplatin has a capability. And it's likely because of this, this potential to reduce the available glutathione. Okay. So continuing with the stream of thought, pro-drug activation by redox. So here we're looking at cobalt-3. So now there's more along lines of Javier, the paper that you and Yolmari were talking about. So here we're looking at cobalt-3 octahedral complexes. And so here I'm just giving you a generic representation of a compound where we're focusing on ligand X. And so cobalt-3, in terms of its chemistry, low spin D6. So this, in this case, that's a spin of 0. And this is something that's exchange inert, so ligand exchange inert. And so the idea is that the metal gets reduced from cobalt-3 to cobalt-2, And so you have something, now you have a different electron configuration where you can have a high spin D7, and you also now have something that is paramagnetic, but in terms of what's more relevant here, that it has a ligand exchange lability. And that's results in the release of ligand X. In terms of the general property, this is something that both of you had mentioned about cobalt itself. The cobalt-3 itself is not known to be something too cytotoxic. So remember, we saw that it was a cobalt acetate that required a fairly high concentration to show any activity. So that's something that in this context, then, the cobalt itself is not necessarily believed to be a contributing factor to the activity itself, but more as something that can serve as a delivery agent. So here, that X would be the actual drug. So the cobalt metal being a carrier more than anything else. So here's just an example where this has been exploited. I'm pretty sure there are examples of cobalt complexes where the metal is important. And because there are many cases where fine-tuning the coordination chemistry can make metals more active, but not necessarily in this particular case. So we're looking at this compound, SN24771. And so the ligand, abbreviated DCE, is known as nitrogen mustard, quite toxic. And so the idea is that the metal center is facilitating the coordination of this type of ligand. And so what we're seeing is, this bidentate ligand through the amines. And so you have it as cobalt-3 initially. Introducing into a reduced environment, the cobalt-3 gets reduced to cobalt-2 that triggers ligand lability, releasing this ligand here. So now this ligand has the capability of cyclizing, so you get this formation of this, this form of it, which actually makes it quite active. And it has been shown that can interact with guanine through the nitrogen, so this base, and it can form an adduct with the guanine itself. And then you can imagine you can have sort of a second cyclization process with another cobalt compound, releasing that ligand and resulting in this sort of this type of interstrand or even intrastrand adducts forming with DNA. So that's a proposed mechanism of action of this particular type of compound, where the metal is just serving as the delivery of the DCE toxic agent. All right. But this particular compound was actually observed to be quite unstable in vivo and ultimately had low potency against hypoxic cells. Right? So it's designed, but in terms of practice, not necessarily effective. All right. So another thing, and I've briefly mentioned this idea of the extracellular environment being acidic and how people can take advantage of that for purposes of release. All right, so you can have attempts to pH activate prodrugs. So here's just a representation to platinum. So you can see there a lot of work done with platinum chemistry just because cisplatin was so effective. You have a lot of studies that have been done to try to evolve that compound and make derivatives. Interestingly enough, you only really have 3 platinum drugs that are US FDA approved. So with all that studies, really haven't left too many compounds. But you still see people really going at it to try to improve, I guess, the selectivity of the compound. All right, so a characteristic pH-activated prodrug is that they must be stable in blood, but undergo a structural change after reaching a region of lower pH that enables their anti-proliferative cytotoxic properties. So here's just a representation of this platinum-2 compound, which would be square planar, and that in the presence of acidity, so here the representation of HCl as a source of acid, it leads to dissociation, in this case of the OH group, or of the oxygen here. And then essentially you're trying to form something that is analogous to cisplatin, right? So you have your cis amines and your cis chloro groups. And that's a consequence of the decrease in pH facilitating this speciation. So the observation of this effect is that you have a pH-dependent IC50 value, where as tested against HT29 colon cells, you see that at a pH of 6, you have an IC50 value of 40 micromolar. Not necessarily wow, but certainly lower than the effect you see at a pH of 7.4, where it has dropped into something that's a little bit more potent, but both of these numbers are fairly disappointing overall. Okay. So observe increased cellular accumulation, GMP binding, DNA platination, as you would expect for the metal itself, and greater effects on DNA secondary structure at pH 6 versus pH 7.4. All right. So let's look at this idea of pro-drug activation by enzymes. So there are several biomolecules that are metal dependent and can serve as effective drug carriers. A primary example of this is vitamin B12. So vitamin B12 is a member of the cobalamin family of compounds, and this particular molecule helps to maintain the normal function of the nervous system and brain, and is important in the production of red blood cells. All right, let's get a view of the actual compound itself. So here is a cobalt-3 compound, and as you can see, it's surrounded by this, taking advantage of this macrocyclic effect. And in the axial positions, we have, which is something like a nucleotide coordinated, and also this important beta ligand. All right, so just what we already mentioned, 6-coordinated cobalt-3, low spin D6, diamagnetic. And so here, the beta ligand is something that's going to be important in terms of drug design. So you've had a number of people trying to take advantage of the coordination capability of the CN moiety. So for the purposes of trying to exploit the vitamin B as a sort of a carrier for these type of drugs. So what you have is, for the purposes of an anti-cancer application, trying to coordinate that CN moiety to platinum and essentially facilitate something that looks like cisplatin. Or, although we haven't really talked about this, and we will talk a bit about this chemistry, or even taking advantage of vanadium, vanadium 5, vanadium 4, for its, it says insulin mimetic. That I'm not a real big fan of this terminology, but whatever. That's what happens when you take images from the textbook. Anyways, insulin enhancing capability that vanadium can actually have. But anyways, so taking advantage of that, that moiety. So here, what you're looking at is this part of the structure to anchor it to the actual metal center from the vitamin B12. So essentially, the idea is that the beta ligand is modified to try to incorporate another metal, and for the purposes for a therapeutic application. So here's just a representation of what's proposed in terms of the chemistry itself. Yeah. Okay.
So it's modified.
Right. So you're basically taking the ligand, this part right here, and then you're trying to functionalize this. You're using the same type of moiety to be able to bring in something else. So an example being, so we have a CN ligand there. That's the beta ligand. So here you have that ligand right there, and that can coordinate to the platinum center itself. Okay. But then over here, you don't have necessarily that ligand. We have something that's very similar that you're trying to build from that, so they can still anchor to the cobalt. So you're going to basically make a derivative of this molecule here, but be able to bring in this whole group. Okay. So here's just a schematic of how this would operate, where you have your cobalt-3 from the vitamin, you have your compound that you're trying to bring in. Enzymatic reduction of the metal from cobalt-3 to cobalt-2 will then result in the release of the beta ligand carrying whatever drug that you're trying to bring into the cellular environment. And so one of the drives for really exploiting this chemistry is that the receptor, the transcobalamin receptor, which can recognize the vitamin, is responsible for taking the cobalamin into the cells, but it's also been shown to be relatively insensitive to what is actually at the actual position. So that was something that was a drive for trying to really take advantage. That it's you can really modify this pretty extensively, and it will still be recognized by the receptor. But that being the case, this particular version, so I'm just showing you the platinum, feature of it. So just imagine that you have the vitamin here still, right? So this modification, vitamin B12, trying to bring in the platinum 2 component, it turned out that in design, it worked, like as in you can make this compound, but in practice, the conjugate was actually less active in terms of its profile against different cancer cells than cisplatin. And it could be having to do with just the relative effectiveness of bringing that compound into the cellular environment, and maybe even releasing the actual drug. that is not as active as cisplatin itself. Another feature that people try to take advantage of is the ability to activate compound via the use of light. So here's just a look at prodrug activation by light, the terminology photoactivated chemotherapy, or PACT. So compounds can be activated by light to be able to release cytotoxic agents. And this is a technique that has been exploited for the treatment of skin cancer. And when you're going beyond skin cancer, right now you're trying to do something that's more invasive, more internal, then you're going to require the use of fiber optics in order to be able to try to tackle other types of cancer like bladder, lung, and esophagus. So for human application and also effective release of agents, it is preferable that the compounds have an absorption wavelength that is in the 620 to 850 nanometer range. The reason for that is that if you need to excite something that's internal and you're trying to use an optic that you even externally or even within the body, this energy has higher tissue penetration. So that's why you would want something in this particular wavelength range, in addition to having a high quantum yield. Quantum yield is a measure of the number of photons emitted by the number of photons that are actually absorbed. All right. So how can we exploit PACT with the use of metals? And so we're going to look at, sort of remind ourselves a little bit about the electronic transitions that we briefly talked about before. So PACT typically is applied with organic compounds just because you can take advantage of their absorption properties. But the field has now evolved really to incorporate metals. And we have not talked about all of these type of transitions, but there are a lot of different transitions that you can exploit depending on the type of ligands that you use and the type of metals that you take advantage of. You have the standard charge transfer type of electronic transition, so metal to ligand or even ligand to metal. You also have the metal-centered transition. That's not the terminology that we used previously, but that is what a d-d electronic transition is. The electrons from the d orbital is excited from lower energy to higher energy. That's what a metal-centered transition is. You can also take advantage of what are known as ligand transition, so either an intra-ligand charge transfer, or if you're looking at heteroleptic compounds, and heteroleptic compounds are metals that have ligands that are not the same ligand. You can have ligand-to-ligand charge transfers. And there are some cases where you have more than one metal in a complex that you can have metal-to-metal charge transfer. So these are things that people have tried to exploit within the design of these compounds. All right, so I've shown this figure. I have not explained this to you before. So this is something you would see towards the later in inorganic chemistry. But I bring it up because it's a source of how we can identify where these type of electronic transitions occur with respect to the use of molecular orbital theory to understand metal-ligand interaction. So here is the one for, here I'm just using cobalt-3 as just an example, just because we've been talking about cobalt-3, but also its ligation by the carbonyl ligand, which is actually pretty relevant here as well. And so this type of interaction facilitates pi interaction between the metal and the ligand. And in fact, the carbonyl ligand is identified as a strong field ligand. And so this type of interaction, we'll respond to that in a moment. This type of interaction facilitates electronic transitions that are of a ligand to metal nature. So every metal complex will have ligand to metal charge transfers. Whether they can be observed is one thing, but they will all have that capability because they always have that sigma donation capability between the ligand to the metal. But depending on the ligand and its capability of pi interacting with the metal, you might be able to also exploit metal to ligand charge transfers. So this would require that the metal have d orbital electrons, but also that the ligand has orbitals that are capable of interacting via pi modality, but that these orbitals can accept electrons from the metal. So when you're talking about the carbonyl ligand, that's one of those classical ligands that are discussed. The carbonyl ligand has an antibonding molecular orbital that can accept electrons, that has the capability of interacting with d orbitals from metals. And so that allows for metal to ligand charge transfers. All right, let me take a moment to answer the question. All right, so ¿Qué diferencia hay si el complejo para el producto de la droga sea low spin o high spin? Es importante tener propiedad en consideración al momento de crear un complejo que se use como prodrugs. ¿Hay alguna ventaja que el prodrug tenga propiedades magnéticas? Okay, so yes, some compounds, their low spin or high spin can also have a contribution to the lability of the compound. And so that's something that in a traditional inorganic chemistry course, I can also look up, show you guys the slides, where you, depending on how many d orbitals are filled with electrons, you may have ligand exchange lability or inertness. And so if you think back to what we were talking about, the crystal field stabilization energy, that is directly tied into lability. So the higher the crystal field stabilization energy of the electrons in the metal, the more likely that the metal is going to be a ligand exchange inert, okay? Because that interaction with stabilizing the electrons. So yes, what Brenda's question is very relevant. Depending on the ligation and whether you have a low spin or high spin situation, can to some extent dictate ligand exchange lability. So that sometimes people do take advantage of that. Now with the rest of what Brenda was saying about the magnetic properties, so typically the magnetic properties, one can exploit that depending on what type of technique you want to look at. So for instance, we are going to talk later on about MRI. That's something that people try to exploit as an imaging agent. So magnetic properties do lend themselves for these type of purposes. I wouldn't necessarily, they might be examples. So, you know, I would have to look at them up where they have a magnetic property that lends itself to activating a compound. So there might be something like that, but typically you're exploiting the magnetic properties of metals for the purposes of imaging. Is that okay, Brenda?
Yes, it is.
Okay. All right, so this is a summary of that figure that we're looking at before. So we're looking at here, and even though we're using probably like terminology that didn't actually used before. So the sources of ligand metal charge transfer within ligand metal interactions, the sources of d orbital transitions within metals, so that would be metal centered, and then the sources of metal ligand charge transfer, requirement of the pi interaction between a ligand and a metal. So a ligand has to have an orbital accessible for accepting electrons. All right, so let's look at examples of how light can contribute to this. So here we're looking at platinum again. So again, as I told you, platinum is always one that people like to really focus on. So platinum 4, we have this complexation where we're looking at these azides that are coordinated to the metal center, okay? So coordination number 6, here, the principal feature is that this has a ligand to metal charge transfer absorbance at 256 nanometers, and that's because of the azides. So you would irradiate this compound at the energy of 366 nanometers, and that irradiation process results in the reduction of the metal from platinum 4 to platinum 2. And as we've discussed, that can lead to then ligand dissociation, and that does lead to the release of these azide ligands. So this particular compound has been observed to be non-toxic. So in the study here, focusing on 5637 human bladder cancer cells in the dark. All right. When I say in the dark, what do I mean? Let me say that, Carmen. What do I mean when I say in the dark?
If you're irradiating, they'd like to know what you're doing or visible light in that. You're hitting the cells and so you're not doing in the dark in order to store it.
Okay, so you're going beyond. In the dark literally means in the dark. All right, so like right now we have no light. Well, obviously there's light on here, but in the dark. So you do this experiment and you run the compound with the cell line, it's absolute pitch dark, those cells are unaffected. But then as soon as you irradiate, so in this case 366, then you see where the cytotoxicity kicks into place. And so it does in fact require the use of this energy in order to activate the compound. So the compound itself has no activity at all. All right, so you irradiate, you release the ligand, and now you're able to see some of the features typical of platinum, for instance, the ability to form the guanine interstrand cross links that are characteristic of what's proposed for cisplatin and related platinum-2 compounds. But you also see that that ligand that's released, you have a radical that's not been released into the cellular environment and it can potentially lead to the formation of reactive nitrogen species and even oxidative stress. So that dual effect that might be possible. All right, so let's look at examples of a photorelease of a bound drug. So here we're looking at 4-aminopyridine. So pyridine has a metal binding capability used for the treatment of the symptoms of multiple sclerosis. That's a disease, a neurodegenerative disease of the central nervous system. So that particular compound can block potassium channels, can stimulate action potential and neurotransmitter release. All right, so let's look at an example of a compound that's exploiting the use of that particular compound. So here we have a ruthenium compound, oxidation state of 2+, that's low spin D6. So here the coordination to satisfy these BIPI is commonly used ligand, but here this is the molecule of interest, right? So that's monodentate. You have two of them that's coordinated to the ruthenium. Here, the important property is this metal ligand charge transfer between 400 and 500 nanometers. That's actually facilitated by the BIPI interacting with the metal center. All right, so I'm just going a little bit back to this part here. So you have ruthenium D6 is interacting with ligands. So go back here. These type of ligands that we see here, they can facilitate high interactions. And so that's going to be important in terms of what we're going to exploit here. So you have the 6 electrons that are in the T2G orbitals of this actual molecular orbitals of the metal. And so you have these T2G star orbitals that are available, molecular orbitals available for the actual ligand itself. All right, so just to characterize this. D6, low spin, you have an S equals 0. An important terminology is the multiplicity. Multiplicity is 2s plus 1. From that, we get the multiplicity of 1, which defines this as a single state. So I think we discussed this earlier in the course, how we can calculate that. All right. Then you have an excitation of electrons from the ground state to a higher energy state. So an example being a metal to ligand charge transfer, where we're coming from the T2G to the T2G star of the ligand itself. So now you move an electron, and I move an electron in exactly the same spin as it was. Let's say we move this electron here, and that electron is not here in the exact same spin down. All right, so if we were to calculate the spin, Javier, what's the spin? You can cheat. Okay, S equals 0, exactly the same, then your multiplicity would be 1, okay? So this is a metal to ligand charge transfer that is a single in nature. All right, but then you can have what is known as an intersystem crossing, where now you flip that spin in that excited state, and now it's pointing up. And so as a consequence of that, you actually change the overall spin, where your overall spin now is 1. And so then you calculate your multiplicity, you have a multiplicity of 3. And so now you have this triplet state, this 3 metal ligand charge transfer. So this is actually a triplet state and is longer lived. And that's an important feature in terms of the properties that we're looking at here. All right. So you have a compound, you irradiate at 500 nanometers, because you're exploiting this metal ligand charge transfer that's capable. What happens is now, because of that metal ligand charge transfer, the metal gets oxidized, ruthenium-2, now we're ruthenium-3. That leads to release of that aminopyridine, and that's the important feature here. And you get the metal now getting back, reduced back down to ruthenium-2. Okay, so I was just emphasizing that as a way of facilitating by this excitation the release of that metal. All right, so let's look at another example. So photorelease of cell signaling molecules. And here we're looking at the carbonyl ligands. I mentioned to you, that's why I showed it previously. So metal complexes can be quite effective in binding and transporting cell signaling molecules, such as carbon monoxide. It's referred to carbonyl ligand when it's a ligand coordinated to metal. All right, but carbon monoxide, depending on its concentration, has different properties. So at high concentration, carbon monoxide is quite poisonous. And so it's one of those silent killers, right? If you breathe it and it's an extensive amount of time, you will die. And so what it does at a higher concentration higher than 300 ppm, it shuts down cellular respiration. In the United States, this accidental carbon monoxide poisoning accounts for hundreds of deaths because it's colorless, odorless, tasteless, and non-irritating. Actually, it's what's used in the process of euthanizing mice, meaning killing mice in what's considered a humane fashion. But at low concentrations, carbon dioxide is quite valuable. So we're talking about lower than 200 ppm as a point of comparison. It's a product of heme degradation that can serve as a signaling agent. It has anti-inflammatory effects. It can promote vascular smooth muscle tone, facilitate grafting in organ transplants, protect against ischemia. So it does have important properties. All right, so ways that people have tried to administer carbon monoxide has been by mixing it with air to try to have certain dosage, or the formulation of metal carbonyl complexes. But sort of earlier compounds with carbonyl are not necessarily a very effective way of releasing the carbonyl itself, not a controlled way. But you can still take advantage of metal complexes to try to facilitate this idea of a controlled release of this molecule. So here, what we're looking at is metal complex prodrug photo CO releasing molecule, or the abbreviation CORM. So released in a dose and site-specific manner. So we're looking at this rhenium compound, rhenium 1, with an electron configuration of D6. So important property is that it has a metal ligand charge transfer at 345 nanometers, facilitated by the BiPi ligand itself. You irradiate this at 405 nanometers, and what that does, it leads to the release of the carbon monoxide. So no longer a coordinated ligand. All right. So found to distribute to the cytoplasm and not the nuclei of human prostate carcinoma PPC1 cells. So here's just a representation within the cellular environment. What we're looking at here as a confocal fluorescent microscopy image of that PPC1 cells, where you have 50 micromolar dosage of the compound. All right, so what we're looking at is the fluorescence emission at 465, 495, you get this blue coloration, okay? But then what we're looking at is the emission that's observed at 660 nanometers. So this is after this irradiation of 405 nanometers. And what we're seeing is this green fluorescence, which is indicative of the transformation of the compound and the release of the carbon monoxide. Okay, so you can see how, depending on the energy, how that lights up. All right. So another really important contribution to the use of light is photodynamic therapy, or PDT. So here, the technology, it rests upon the presence of oxygen, right? So you can imagine that's interesting, because now we're talking about the use of oxygen as a way of trying to kill cells. So the idea is that you're using light on something that's called a sensitizer. And that sensitizer is going to convert oxygen from its triplet state to a singlet state. And so the singlet state is actually a very reactive form of oxygen that can have the capability of killing cancer cells. And so in the original application of this technique, you had these type of compounds like photoferrin or former sodium that was used. And so these first approved sensitizers were these type of molecules, not metal-based. And so there's a oligomer of protoporphyrin 9. We've seen that particular compound when we talk about heme, was used for surface tumors, okay? And so it has a long-term phototoxicity, which is the reason why people that were given this treatment, they could not be exposed to sun, because if the presence of this can exist in the body for quite some time, and then you don't want to keep this active, right? So you try to minimize your exposure to UV. All right. But this type of technology has evolved by the use of metals. And so you have metals that bind to organic sensitizers to enhance the photodynamic therapy, because they facilitate faster and longer-lived sensitization. I will explain what I mean by that in a moment. So here's just some representation of some metal-containing compounds interacting with similar type of ligand systems. And so those ligand systems are actually important. All right. So you probably have all seen this, the Jablonski diagram. We all have taken physical chemistry. So here's just a representation of what the photosensitizer is doing and how that reacts with oxygen. And so here, what we're looking at is the photosensitizer in its ground state, so lowest energy, excited, in this case, you're going from a low energy electronic state to a higher energy electronic state. So that's their absorption. So what can happen is you have a relaxation and fluorescence, which is basically emitting and going back down to the ground state. But another thing that can happen is an intersystem crossover, so that ISC, as we briefly mentioned before, where you go from a singlet state to a triplet state. And so in that triplet state, you can have then the going back down to the ground state, and that is what is known as phosphorescence, or you can exploit something that's in the triplet state to transform oxygen. Okay, and so we're going to look at that in a moment, leading to potentially reactive oxygen species or potentially the conversion of oxygen to a singlet state. All right, but we'll look at that in a moment. All right, so going back to this, when I was talking to you before, the example of the metal ligand charge transfer. So here we're looking at D6. The metal itself, I have ruthenium, but I'm more focused on the actual, the multiplicity. So here, just to remind us, we have the singlet state, you have the excitation, and the intersystem crossing to give us a triplet state. So this is the state that's important, especially with regards to metals, as it can facilitate this, something that can last for a significant amount of time. So in terms of designing compounds as photosensitizers, so here we're comparing and contrasting certain compounds with respect to organic compounds. So this is what we can refer to as the sort of the first generation of PDT agents or photosensitizers, which you have excitation from the ground state to an excited state, and then crossover to a triplet state. And so the crossover was slow, okay, so it was a limitation of this. And then going from this state to back down to the ground state was also slow. The limitation of the intersystem crossing being slow was what people tried to improve upon, because we want that, that conversion to be fairly quick. So the use of metals really helps improve this. So you have certain metal complexes that can facilitate that intersystem crossing to be really quick, but certain metal complexes also have a very quick conversion from that triplet state back down to the ground state. So that in itself, that fast conversion there is a limitation. But that's why what's more ideal is these metal organic diodes that can facilitate a fast conversion, but also a very slow conversion back down to ground state, so that it exists long enough that you can take advantage of it to really modify oxygen. All right, so that comes to this point here. So now you have your triplet state, and so what can happen? Well, what can happen is that you can exploit the energy as it's going down to the ground state to convert oxygen from its triplet state to a singlet state, okay? So we'll talk about that in a moment. Another thing is that you can release the electrons that's in the triplet state photosensitizer. That released electron can react with oxygen, and that triggers what we know as reactive oxygen species in an uncontrolled manner. So you can have these two type of processes. Type 1 was an electron transfer from the triplet state to the oxygen, giving you the reactive oxygen species, or type 2, which is an energy transfer that helps to form the singlet state oxygen. All right. So I think everyone here knows how to produce this molecular orbital diagram for oxygen. Is that correct? All right. So here we're looking at the molecular diagram of oxygen, but there's something that's missing. What's missing in my molecular diagram? What's missing is just those annoying little connections to where these came from. So we have this molecular orbital diagram where you have the formation of your sigma molecular orbitals, your pi molecular orbitals. So we have the 2s orbitals from the two oxygens, giving us a sigma bonding molecular orbital and a sigma antibonding molecular orbital. But what's important for us is what's happening with the p orbitals. So we have the pz orbitals that can form these sigma molecular orbitals. So the sigma bonding and sigma antibonding, but then the px and the py that form the pi interactions. So the pi bonding molecular orbitals and the pi star antibonding molecular orbitals. All right, so you have this molecular orbital diagram, and so we can calculate the multiplicity. All right, what is the multiplicity of this? Let's first start off, what is the spin, Javier? Spin is 1. Okay, Carmen, what's the multiplicity? Multiplicity is 3, 2s plus 1. So we have a triplet state. Okay, so that's triplet O2. Okay, then we can have an excitation which can change the spin. So this is a representation. You can change the spin of one of those electrons, giving us something like this. But now we have one that's spin down, and that gives us a spin overall of S equals to 0. That S equals to 0 changes your multiplicity. So now it's a multiplicity of 1. And now you have an example of singlet state oxygen. And singlet state oxygen is quite reactive. It's actually something that's the purpose of this type of technology that can hurt cells. So Professor Sharon McFarland, so a few cycles ago of this course, she actually came to talk about her development of PDT and how her particular compound was undergoing clinical trials. And so this is their relationship. She developed this company, but she was just showing us the optic fibers that are used for this treatment, very promising results. I forget where they are right now with this particular technology, but showing us an application of PDT that came from the academic setting. All right, so the feasibility of PDT. So advantage is that it's something that's going to be targeted in terms of where it's applied, but then you're going to have the disadvantage of, depending on what type of cancer you're talking about, you might have limited penetration. And even if you're using that optimal wavelength that I was telling you, you're still going to have, depending on what part of the body, limits of how that energy can reach the particular tissue. And if you're exploiting the use of oxygen, and I already mentioned to you, there are going to be those cells that are in a hypoxic environment. You may not have an accessible enough of oxygen to really exploit this technology. But you have examples where people are trying to look at other cellular species that can take advantage of photodynamic therapy for this application. Okay, all right, so before we head out, any questions, any doubts?
La multiplicidad del que era de 0 era cierto.
¿De qué?
La multiplicidad del que el spin era 0 era.
2s plus 1. So 2 times 0 is 0, plus 1, 1. So it's singular. Any questions? All right, I'll see you all next week.
Una semana Santa.